911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
This is Susan London reporting from the annual meeting of the American Society of Clinical Oncology in Chicago. I'm talking with Dr. Andreas Dubois about trial of Pazopanib for maintenance therapy in advanced ovarian cancer. Can you briefly sum up your findings for us?
Yes. So we did a phase 3 randomized trial, placebo-controlled in patients, and they were entered after having completed their primary treatment. So they had already surgery and upfront chemotherapy. So most of these patients do not have any visible tumor at that moment. That was 85%. So we know that these patients are at a high risk for relapse. So the relapse rate is about 70 to 80%. So we evaluated this drug in this setting to maintain the initial successful therapy. So we gave 24 months of Pazopanib or 24 months placebo. We found about 6 months gain in progression-free survival. So that was a significant improvement and gain of time where patients control tumor and not tumor-controlled patients. So that adds a valuable, significant amount of time to the patient.
Did you perform any subgroup analyses?
Yes, we did. So we looked on the typical subgroups, so patients with more advanced disease, stage FIGO4 disease with distant metastasis, and we found in all subgroups, we found the same efficacies. There was not one subgroup without that benefit. We looked in elderly patients, younger patients, and we looked on patients who had a complete surgery or an incomplete surgery, and we found all the same in all subgroups. So this is a drug that really acts against that disease in all the patients we gave it.
Could you compare Pazopanib with other options for maintenance therapy out there, such as bevacizumab?
Yeah, currently we don't have a pure maintenance therapy on the market. We have bevacizumab, which is a drug given together with chemotherapy and then continued during the maintenance therapy phase. So that drug has also proven activity about the same size, about 4 or 5 to 6 months gain in progression-free survival. These drugs have not been compared, so currently we cannot say whether one drug is better than the other. And the populations are a little bit different. The Pazopanib trial included patients without residual bulky tumors, while the bevacizumab trials were mainly performed in patients with macroscopic, visible, and bulky tumors.
Do you think that there might be a role for this agent earlier in the course of this disease?
I think so. This is a good option for frontline maintenance therapy. The next generation of studies have to evaluate how the different targeted agents should be used in sequence. So currently we don't know that. But I think Pazopanib adds a valuable option to that. And we have to figure that out in the future.